You're kneeling on packed earth inside a hut somewhere in Neolithic Anatolia, and the smell hits you before anything else. Sweat, smoke, and blood, thick enough to taste. A woman has been in labor for 2 days. Her sister presses a wet cloth against her forehead, while an older woman, the closest thing this village has to a midwife, kneels between her legs with nothing but her hands, a bone knife, and a prayer. The baby is stuck sideways. Everyone in the room already knows what that usually means, even if nobody says it out loud. The obvious question is simple. Why didn't ancient people just cut the baby out? We've technically known about cesarean delivery for thousands of years. Here's the flip. For almost all of human history, a surgical delivery wasn't a rescue. It was something closer to a death ritual, and only for the mother. The real story isn't about whether ancient people knew how to do this. It's about who they were willing to do it to, and that detail changes everything. Here's what nobody tells you. For most of recorded history, the cesarean section wasn't performed to save a mother's life. It was performed after she was already dying, or already dead, purely to pull the child out before it died with her. And the evidence for how long that stayed true is genuinely brutal once you see the timeline laid out. The earliest written trace of this practice comes from Rome, not a hospital. A legal code often called the Lex Regia, attributed to the era of King Numa Pompilius around the 7th century BCE and later folded into Roman law, required that if a pregnant woman died before giving birth, her body had to be cut open so the child could be delivered and buried separately. This wasn't medicine. It was religious law about burial rites. The word Cesarean itself carries a myth here. Pliny the Elder, writing in the 1st century CE, linked the Caesar family name to an ancestor supposedly born this way, which is almost certainly folk etymology rather than fact. But the story stuck for 2,000 years, which tells you something about how societies wanted to remember this procedure. Now here's the surprising part. Surgical delivery on a living mother, with any real intention of both surviving, doesn't show up reliably until the 16th century, and even then it's murky. The most cited case is Jacob Nufer, a Swiss pig-gelder, who is recorded in accounts written decades after the fact, so treat this cautiously, as having performed the procedure on his wife around 1500 after a failed labor, with both mother and child reportedly surviving. Not folklore, though. The Sushruta Samhita, an ancient Indian surgical text compiled roughly 2,600 years ago, describes abdominal surgical techniques detailed enough that historians still debate how much surgical knowledge South Asian physicians actually had access to at the time. What changes across every one of these sources? The mother almost never lived. The conventional story most people carry around is that ancient and medieval people simply didn't know how to perform this surgery safely. Except that's not quite what the historical record shows. They knew the anatomy well enough to locate the uterus and remove a child successfully within minutes. What they didn't have was any way to stop what happened next. A pregnant uterus is soaked in blood vessels built to feed a growing fetus. Cut into it, and you're not dealing with a wound that clots and closes on its own. You're dealing with catastrophic bleeding that nothing in the ancient medical toolkit could reliably control. There was no reframe here about ignorance. There was a physical wall nobody could get past for roughly 2,000 years. And that wall had a name doctors avoided saying out loud: hemorrhage. The real turning point wasn't a discovery about how to cut. It was a discovery about how to close. In 1876, an Italian surgeon named Edoardo Porro developed a technique that removed the uterus immediately after delivery specifically to stop the bleeding that had been killing mothers for millennia. A brutal solution, but one that started saving lives. Then in 1882, a German obstetrician named Max Senger introduced something that sounds almost embarrassingly simple in hindsight: stitching the uterus closed with silver wire sutures instead of leaving it to bleed out. It's a strange thing to sit with, the difference between a woman surviving childbirth and not for most of human history sometimes came down to whether anyone had thought to sew the wound shut. What does this mean for how we understand ourselves? It means the barrier standing between an ancient mother and a modern one wasn't intelligence or courage or even surgical skill. It was thread. To understand why this took so long, you have to understand what's actually happening inside a pregnant body. During pregnancy, blood flow to the uterus increases dramatically to support the fetus. By the third trimester, roughly 500 to 700 milliliters of blood are moving through it every single minute. Cut into that tissue without a way to control bleeding, and a mother can lose her entire blood volume in a matter of minutes. Add 2 more missing pieces and you understand the full trap ancient surgeons were in. There was no anesthesia until ether was first used publicly in 1846, so any surgery was performed on a fully conscious patient, which limited how much time a surgeon could realistically take. And there was no understanding of infection at all until Ignaz Semmelweis, a Hungarian physician, demonstrated in 1847 that something as simple as hand-washing between patients dramatically cut death rates, a finding the medical establishment of his own time largely mocked him for. Let that sink in. Mothers were dying not because ancient doctors lacked courage, but because 3 separate scientific discoveries, anesthesia, infection control, and controlled bleeding, all had to arrive within about a 40-year window before this surgery could reliably save a mother's life instead of ending it. This isn't a story confined to one culture. In 1879, a Scottish missionary named Robert Felkin documented an indigenous surgical delivery performed in the kingdom of Bunyoro, in what's now Uganda, where a local surgeon used banana wine as both antiseptic and anesthetic and cauterized the wound with a heated iron, a technique developed completely independently of European medicine, and by some accounts more advanced in its infection control than what was happening in European hospitals at the same moment. Zoom out even further, and the pattern isn't just cultural, it's biological. Humans are one of the only species on Earth where childbirth is genuinely, mechanically dangerous by default. Anthropologists call this the obstetrical dilemma, the collision between a pelvis shaped for walking upright and a skull evolved to carry an enormous brain. Elephants, whales, even most primates don't face anything close to this level of birth risk, because they didn't make the same evolutionary trade. Sit with this for a second. The very first version of this surgery, under Roman law, wasn't designed to save a mother at all. It existed specifically for cases where she was already considered beyond saving, so that only the child might live. For nearly 2,000 years afterward, that same basic calculation quietly persisted in how the procedure was used, and in whose survival was treated as the priority when a choice had to be made. Uncomfortable question worth asking. How much of what we now call maternal medicine only exists because enough mothers died that it became impossible to ignore? There's nothing sentimental about this history. It's closer to an accounting error that took 20 centuries to correct, one written on the bodies of women who were rarely given names in the records that survived them. The honest answer is, we don't know exactly how many ancient mothers might have survived if just one of those 3 discoveries, anesthesia, antisepsis, or a needle and thread, had arrived 1,000 years earlier, and we probably never will. But next time you hear about a scheduled cesarean, a routine outpatient recovery, a mother home within days holding a healthy newborn, you're witnessing the end product of one of the longest, quietest medical struggles in human history, one that took 3 continents, 2,000 years, and a Swiss pig-gelder's wife to finally get right. We spent 20 centuries trying to save the mother, and it turns out the answer was never a sharper knife. It was just remembering to sew the wound shut